Should I use ice or heat for my shoulder pain? It's an age old question as common as your clients asking you whether they should do cardio before or after weight training for weight loss. Let's break it down so you know exactly what to do the next time that pain strikes. Ice can be a go to option when you're dealing with acute or fresh onset pain. Think of pain associated with swelling, inflammation, or discomfort shortly after an injury or a flare up. You can think of it like hitting the pause button on that fiery or throbbing pain that you've been experiencing by providing temporary relief. For example, if you tweak your shoulder during a heavy lift or feel it flare up after overtraining, and the pain is impacting your ability to effectively sleep or perform simple daily tasks such as consider grabbing an ice pack. Apply it for 10 to 15 minutes at a time over the affected or painful area. But be sure not to overdo it, as icing for too long and too often can slow down recovery. In fact, the long held belief rice or rest ice compression and elevation was best for acute pain and injuries has since been replaced by the acronym Peace and Love. And it does not include prioritizing ice as it may slow down the first phase of the healing process. With that being the case, I do still find strategic uses for ice. Ice can be helpful when clients are able to use it as an effective alternative or adjunct to medications like painkillers or stronger anti inflammatories. Ice can be sufficient enough at times to help people find relief at night, reduce stress during the day, and aid in overall recovery versus dealing with the pain. If you do elect to use ice for this purpose, I highly recommend sticking to short, controlled sessions of less than 15 minutes for the best results in terms of temporary pain reduction while slowing down the healing process as minimally as possible. Heat, on the other hand, is perfect for chronic pain or stiffness, that tight, achy feeling that sets in after weeks or months of overuse or less than optimal recovery. Heat increases local blood flow, assisting in relaxing tight muscles, and helps ease overall muscle tension. Think of it as giving your shoulder a big warm hug to help to loosen things up. If your shoulder feels stiff after a long day, or you're battling lingering pain that keeps you from your favorite lifts, heat can help. Use it for about 15 to 20 minutes per session to get things moving and feel more comfortable heading into your next rehab session or before bed. One thing to avoid that I commonly see trainers do is mixing up when to use ice or heat. Using heat on a fresh injury can make swelling worse, while relying on ice for chronic pain or discomfort won't do much to help the joint stiffness or to improve local blood flow to those aching muscles. It's all about using the right tool for the right job to help maximize your relief and recovery efforts. Here's the truth: while ice and heat can help with the temporary pain relief, they unfortunately won't fix the underlying causes of your shoulder pain. Tools like these are great for managing symptoms, but they're not a solution in and of themselves. Chronic pain that persists after normal tissue healing timeframes, especially in the shoulder, often comes down to resolving issues like muscle imbalances, poor movement patterns, or less than optimal recovery and programming. If your shoulder pain is holding you back, it's time to go deeper and explore the root causes. And remember, moving smarter today means lifting stronger tomorrow.